we hear a lot more about concussions now than ever before, right? I feel like we're hearing a lot more about it. Maybe we're seeing it more in practice. Why do you think that is?
Well, there's a lot more data on concussions now. More practitioners are detecting concussions, so they're more reported. The Journal of Neurology came out with a statistic that 4 million people in the US annually have concussions, and that's just people who go into the ER. And then you have to imagine there's a bunch of other people who've had concussions who don't seek medical care. So we think that's a gross underestimation, and that's still 4 million people. Also, the movie Concussion helped with public awareness. Yeah. So I think that there's just a lot more education in general, along with the public awareness of it.
Yeah. What specifically is the optometrist role when it comes to concussions and concussion care? I mean, what role do we play?
A massive role. One of the biggest consequences of concussion is vision issues. Some of the studies say up to 70, even 90% of people after a concussion have a vision problem. So I think optometrists have a huge responsibility in at least screening for any vision conditions after a concussion, or potentially being the first practitioners that could detect it.
Yeah. What are some of the most common, well, actually, let's take a step back. I mean, how do you actually tease that out? Because, I mean, do you add it to your patient intake form, your case history? I mean, how do you tease these things out? Because, sometimes you're doing an exam, and then all of a sudden at the end of the exam, mom will say, oh, by the way, Johnny had a concussion the other day. And you're like, oh, well, I had no idea.
Right. So I am very fortunate because in my practice, I see patients that have already been diagnosed with a concussion. So most of my referrals come in from other ODs, neurologists, primary care doctors who suspect a vision problem. So usually there's a visual symptom. I'm not really the first person that this patient is coming to see. But if vision is the first symptom, like let's just say double vision, somebody is knocked in the head, they fell down snowboarding, they all of a sudden have double vision develop after that, they might see an optometrist. And so it would be just very important to measure eye alignment and also pursuits. So there's some key visual skills testing that a primary care optometrist could absolutely detect dysfunction.
Yeah. So before we jump into all that, I mean, let's start with symptoms, right? Signs and symptoms, I guess. I mean, what are some of the most common signs and symptoms that a patient has had a concussion, or patients who have suffered concussions, what do they typically present with in the exam room?
Absolutely, headaches. And I'll say these in order of how often I see them and other practitioners in the concussion group that I work with. I would say headaches is number one. Some type of vision issue, whether it's light sensitivity, blurry vision, double vision, difficulty with near work is another big top symptom. Dizziness, nausea, motion sensitivity, those are probably the big ones. Some of them will come in and say they have cognitive deficits like memory issues. Okay. But I would say headaches and vision issues and balance issues are the top three. So
those are the top three. And so when a patient says this, I mean, let's think about it from the perspective of a primary care optometrist, right? You might not have a lot of experience with concussions, I guess, but do you think the primary care optometrist is equipped to at least manage some of the more common or some of the easier, so to speak, symptoms for that patient? Or is it always, vision therapy? I mean, what are the treatment options, I guess, is where I'm getting into.
Such a great point. I definitely think a primary care optometrist can help manage and treat post-concussion patients. Just starting in the history, you can add in just a few key questions that can help hone in on post-concussion vision issues. Asking about headaches, particularly headaches with reading or near work, double vision, blurry vision. A big thing would be change in vision post-concussion, and this can vary. Some people develop symptoms pretty closely after the concussion, but a lot of people, it can take hours or even days. Wow. So that's why with athletes, we have to be careful with sending them right back into play.
So let's just say a patient comes in with, they've had a concussion and they have a headache. They're suffering from headaches. what is the frequency? When do they occur? Is it always a tie to kind of near work, or is it just going to be random?
That's a great question. So some of them have post-concussion migraine-like headaches where they're more diffuse. So they might just have any particular pattern all over the head is a common one that I hear, and they need to be managed for migraine pain. The headaches that are visually related, usually that's with near work or lights, where it triggers a headache. And a lot of times, convergence insufficiency, for example, can lead to headaches, and they're usually in the forehead area or the temples around the eyes. So that can be really indicative of a specific vision condition.
Right. And light sensitivity is something I hear a lot because we've all had those patients that present who have had concussions, and a lot of them say, I'm very sensitive to lights. Is there specific tints that you can use for these patients, and what does that typically look like? What do you typically recommend?
Yeah, so the top 2 popular tints that I prescribe are 10% blue for indoors. That's probably the number one, and I test various tints, and by and large, that's the one that provides the most comfort. Mm-hmm. Blue can be calming, but at the same time, it doesn't make people sleepy, and this is all subjective for them. But I can sometimes look at them after they put on the blue tint and notice that they're not straining their eyes anymore, they're not furrowing their brow, they look a little bit more relaxed, and they could handle brighter lights in the exam room. Another popular one is FL41, which is kind of a rose tint. So those are the top 2.
Gotcha. So I'm thinking, okay, if I want to start bringing concussion treatment, so to speak, to my practice, I have no idea where to start, right? So I'm kind of starting from scratch. What are the first steps, or what are the steps that I need to take in order to do that? Do you have to be a vision therapy practice, so to speak, or do you have to offer vision therapy to do some sort of level of, or offer some sort of level of concussion treatment?
Absolutely not. I think you can start with the primary care optometrist, and I think that optometrists are really responsible for treating these patients because they oftentimes are just struggling. They don't know that vision treatment even is an option. They kind of just muster through it, and then they make poor adaptations to their new vision issues after concussion. So it definitely starts with a good, solid case history where, if I was a primary care optometrist, I would just add a special box for have you ever had a concussion? And then if the answer is yes, figuring out the details of that injury, when it occurred, and then specific questions, and you can just add in maybe 10 questions specific to that concussion that can help the optometrist figure out if there is a vision issue as a result of it.
And then, okay, so after you've got your case history, I guess, what does your examination look like? What tests, I guess, are you doing specifically to investigate?
So, of course, my vision therapy evaluations are between 90 minutes and 2 hours. Okay. So the primary care optometrist doesn't have that luxury.
Probably not going to.
So you can do some basic tests in the exam that they may or may not be doing already, or they might already be checking. So, of course, covered visual, it's all the tests that primary care optometrists do are going to be helpful for a post-concussion patient, but particularly looking at visual skills like binocular vision, so cover test at distance and near, the extraocular movements, looking for competency, making sure there's no vertical misalignment because you're really assessing cranial nerve functioning there. Saccadic functioning, so it can be 2 targets where they look back and forth between the 2. If you want a little more sensitive test, the King-Devick test is a quick rapid number naming test that has been well researched for concussion issues. So that could actually be a part of pre-testing too. The refraction can give a lot of information, so if the vision fluctuates a lot, that can give you insight into their accommodative system and whether or not they have dry eyes, because dry eyes is another issue that's a post-concussion problem.
Very interesting.
And part of that is because they tend to stare more because they're trying to converge, they're trying to focus their eyes more if they have that sort of visual skill issue. So it's just a matter of blink rate for those patients. So definitely looking for dry eye and treating that if that's part of the issue. Of course, we talked about light sensitivity and tinted lenses, which can be very helpful. A lot of the patients with light sensitivity will come in wearing sunglasses or hats, and it's important to help them get used to light again. So by using a lighter tint indoors, you're actually helping their visual system.
No, it makes a lot of sense. And, at what point do you start to ask yourself, okay, this is no longer something that I can treat and manage with, a change in prescription, tints, that kind of thing. I think this patient needs something more, vision therapy, rehabilitation. What do those cases in particular look like? And then what does that entail?
I would, if the practice doesn't offer vision rehabilitation or vision therapy, having good people in the area who are COVD or NORA, are fellows of COVD or NORA are really helpful. And just creating close relationships with them. And typically those vision therapy optometrists will I would say 99.9% of the time refer the patient right back to the primary care optometrist where they're referred. So just having a go-to practice or two in the area is really helpful. I will also say a small change in refraction in the prescription can make a big difference for the patient. So even a quarter, sometimes I'll refract down to even 0.12 because they're more visually sensitive, and just a little bit of power for them goes a long way.
Yeah. And you are starting to build your own concussion clinic, so to speak, right? Within a like a group, I suppose, right?
Yes.
Talk a little bit about that, and what are some of the things that you're doing? I mean, what does that look like? Because you're kind of starting from scratch, right?
Yeah.
So what
I've been building this year.
So how do you even do that? Where do you even go? Where do you even begin?
Practitioners in other specialties in my area decided to come together. In particular, a cognitive therapist decided to start a multidisciplinary concussion clinic. And so she's brought on various practitioners, neurologists, physiatrists, cognitive therapists, physical therapists, vestibular therapists, and neurooptometrists and vision therapists along with that. So I'm building the vision therapy portion of it. So we're partnering in a sense. It's sort of a unique environment, but what we've always heard with post-concussion care is that the multidisciplinary team is key. So it's a place that patients can go to for all the care that they need, and it's patient-specific. So one patient with no concussion is alike. One patient might need only vision therapy, while another patient might need all the therapies that are offered, and maybe even more.
Yeah. What was one of the most challenging cases that you've personally managed? I mean, is there one that stands out in your mind that, took months, years?
Well, with post-concussion, it's mild traumatic brain injury. So typically my patients are done in less than a year. And I would say that the more severe cases are patients that had a concussion and vision issues for more than a year or two. So they make maladaptations and they're just more locked in. So it takes a while, repetition, practice with the vision exercises to develop their binocular vision, accommodative ocular motor system again. And then with another layer of if we're also working with visual processing issues like visual memory or visual processing speed. So it all depends on the patient, and it's completely individualized for them. But I would say the hardest cases are the patients that have been suffering from the problem with a year or more.
And what age range do you feel like, and I'm sure this varies as well, but what age range do you feel like concussions are most prominent? Do you think it's more in the younger demographic now, the athletes, because there's more focus and attention on it? Or do you feel like you're seeing more concussion in a different age range?
More risk, more likelihood. So it's usually teens, male teens, from I think 15 to 19 is the highest prevalence. In my area, most of my patients are over the age of, it's between 18 and 60, and that's just because that's the demographic that we tend to get. And most of them are concussions related to motor vehicle accidents and whiplash injuries. Another age range for a pediatric neurooptometrist would be 0 to 4. And they're much more concussions are much more common in men than women, or males and females. So, although females report more symptoms, so
Right.
there's a little bit of a mismatch there.
Yeah. Do you think that maybe that age range, that, like you said, 15 to 19, those athletes are kind of hesitant to talk about it because they're afraid that you might say, well, you can't play sports anymore, you've got to stop? I mean, do you ever run into those issues?
Yeah, absolutely. I think when they come to me for vision therapy or vision rehab, they're usually already symptomatic and they're aware of their symptoms. But I have had once in a while patients that their parents force them there and they don't want to be there. And of course, if they don't comply with the therapy program, they don't make as big of progress, even though they have significant vision issues. So I think there's a level of pride. I think there's also a level of motivation. Like, I'm just going to muster through these symptoms. I'm going to push myself and push myself. But they may be able to get away with that for a certain period of time, and then it eventually catches up, whether that's in college or later.
Yeah. So, I mean, you've convinced me. I'm going to start adding, I want to add this to my practice. I'm convinced. But the problem is I really don't know anything about it. What resources, or where would you advise me to go find some information? Or where can I kind of inform myself, educate myself?
Networking is a great way. So the vision therapy community is really friendly and arms wide open, loves when new people want to bring vision therapy into their practices, or at least get more information on it. If you're a textbook learner, there's a handful of great vision therapy textbooks that will specifically talk about concussion care. There's Neurovision Rehabilitation, I believe, is a book that I really like, and I think it's straightforward. It's an as easy read as possible as a textbook could be, but I think that would be a great place for a primary care optometrist to start. Len Press's Vision Therapy Concepts is also a really great textbook. And then, of course, covd.org and NORA's website, Neuro Optometric Rehab Association, is another great resource where you can find papers and you can join the community and become a member, and then attend the annual conferences, do continuing education, and you just find your own learning path with however best you learn. And another option is for a primary care optometrist to bring a vision therapy specialist or optometrist on board into the practice.
That's a great pathway. Yeah, it's something that you don't even sometimes think about. What so if you had to leave those watching with just top, your top tip for when it comes to kind of dealing with patients with concussion or finding these patients in their practices, I mean, what would your top tip be for these optometrists?
I would say just be empowered and know that the existing tools that optometrists have can help post-concussion patients, and that vision issues are extremely common post-concussion. So we're talking about if the concussion didn't heal properly. So after 2 or 3 weeks, that's a normal healing course for a concussion. So if there are persistent symptoms after 3 weeks, and sometimes it's 3 to 4 weeks, especially if I have an older patient, I might wait 1 month to evaluate.
Got it.
So that's when we're talking about post-concussion syndrome issues, and that's usually 15% of people after a concussion continue with persistent vision issues or persistent symptoms in general. So that's when you really want to hone in on those case history questions and really looking at the binocular vision system, accommodation, ocular motility, dry eye, light sensitivity, any changes in their refractive error, especially if you have a baseline where you've seen them year or 2 prior. That's really helpful,
right,
to have those baseline assessments.
Yeah. And where can people reach out to you if they, have questions for you? Is there, a specific email address that anyone watching can reach you at? My email is dralexvision@gmail.com, and my website's dralexvision.com. All right. Well, thanks for spending the time with us, talking a little bit of concussion. We'll definitely have to do this again.
Absolutely. Thank you.